Greetings to everyone. This is Dr. David Hanekom, Global Chief Medical Officer of Solve.Care. I really appreciate you joining us to have a discussion about some innovative ideas around empowering patients to improve clinical care. If I can have the first slide, please. I'd like to start off with a quote from an individual that is well known to most of us that know about the Mayo Clinic. Dr. Mayo was one of the founders of the Mayo Clinic, and he was very famous for saying that the best interest of the patient is the only interest to be considered. And in order that the sick may have the benefit of advancing knowledge, union of forces is necessary. I think that sets for us the understanding that healthcare delivery is really a team sport, and that the quality of the collaboration and the intensity of the collaboration and the best interest of the patient is really what's going to drive the various outcomes that we are trying to achieve for individual patients and for a large group of individuals through population health management programs. So if we can remind ourselves that the prime purpose of healthcare delivery is to make sure that we meet the best interest of the patient. And you'll hear me referring to this principle throughout the presentation today. Next slide, please. I am very pleased to introduce later in the talk Ms. Jami Berger, the Executive Director for Operations of the Arizona Care Network. Solve has had the privilege of working with the Arizona Care Network over the last few years in the development of our blockchain solution to drive the quadruple aim, where our aim remains the goals of delivering better care, drive increased patient and provider or physician satisfaction, and to lower the total medical cost associated with healthcare delivery. Please allow me to introduce Jami. And Jami, if you want to make a few comments, opening comments, and then I'll continue with the webinar. Next slide, please. We're going to talk about the use of blockchain technology to address the issues related with large populations that need to be managed who have chronic conditions. As we know, chronic conditions is a major driver of healthcare costs as well as associated morbidity and mortality. And we're going to talk about that in the context of adult diabetes. You will see that diabetes is a significant burden, not only in terms of people's lives and quality of lives, but also associated with mortality. And when you look at the predictions for the future, in terms of what's happening with the prevalence and incidence of diabetes, you can see a significant shift, not only in where diabetes is occurring, but the intensity and the prevalence of it, with a significant increase occurring in Southeast Asia, as well as Australia. Of course, in North America, we have our well-known issues related to diabetes, and the pandemic associated with increased diabetes and its consequences is only going to get worse as time goes by. So from a population health management perspective, and as a focus on applying the best care management principles and technology to addressing a population health problem, type 2 diabetes will remain on our radar for the foreseeable future. Next slide, please. When we specifically focus on the situation within the United States, you can see that adult diabetes mellitus is very much clustering around the southeast United States in that Tennessee, Mississippi, Louisiana, Alabama. But it's a problem in most of our states, and we're spending a significant amount of our resources on the management of patients with diabetes. Not only is diabetes a common condition, but the associated comorbid conditions such as hypertension, cardiovascular disease, cerebrovascular disease, associated renal disease, and other complications associated with diabetes is resulting in significant burden. And so a focus on making sure that we can manage patients with diabetes and the associated comorbid conditions will benefit a very large number of patients. And you will have noticed that most payers, as well as the federal government through its various programs, be they disease management programs, incentive programs, shared savings programs, or risk-based contracts, also focus on the adult diabetic patient because of the complexity and the ability to impact their clinical course as well as the resources associated with managing these patients. Next slide, please. There are multiple challenges facing healthcare providers, whether you're an organized system of care or an individual physician, in managing populations with chronic conditions. And in the case of diabetes, there are always four questions that I ask myself as I think through how do you manage a impactful condition that is present in a large number of patients, not just in the United States, but across the world. And so the first question I have for myself, and we'll discuss this today, is how do you empower patients to take responsibility for and actively participate in their care? You will very often hear from the provider side and the network side that there is a challenge in getting patients engaged in actively participating in their care, and that is acting as a barrier to successful clinical outcomes. And so I want to look at some of the factors associated with that and potentially how we can engage patients to drive better engagement and more active participation, because that participation is essential in terms of delivering the clinical outcomes that are necessary in a patient with a chronic condition. The next question is, how do you connect the various role players within the healthcare delivery system and the ecosystem to ensure that there's effective care coordination across care networks? We certainly have significant resources deployed in the United States and elsewhere on trying to care coordinate across a very complex, a very fragmented healthcare system. And so how does one scale that and improve the care coordination, because it's foundational to successfully managing a patient and their family longitudinally across a very complex ecosystem? And then what tools and processes are required to facilitate collaboration and drive preferred outcomes, on the assumption that we are able to intervene effectively from a clinical evidence-based medicine perspective, and we have the necessary resources and tools available. How does one coordinate this ecosystem so that you can drive the maximum benefit to the maximum number of patients? And then lastly, what role does distributed ledger technology play in addressing the above challenges? And so we will focus in the next few slides on trying to answer some of those questions, which I think will help explain the potential role for distributed ledger technology or blockchain enabling that process. Next slide, please. What I'd like to propose is that we redefine or create a new paradigm for patient engagement. And I would like to share with you our thoughts around the role of a personal care circle in care coordination and chronic disease management, with specific reference to the adult diabetes population. Next slide, please. Traditionally, within healthcare, we have become and we have striven to be patient-centric in terms of our approach to the best interest of the patient. In other words, we all strive to put the patient in the center of all we do and then provide the necessary services and support to the patient so that we can drive in each individual patient the best quality of life, that we can prolong life, and that we try and utilize the resources that we have available to us, which are not infinite, to the best interest of the largest number of patients. And this has certainly been successful, but it hasn't given us the degree of success that I believe that we are able to achieve if we change the paradigm. And so the suggestion is that we, from a population health management perspective, because of the large numbers of populations that we have to deal with, for which there are probably not enough human resources available currently, that we shift the paradigm from a patient-centric approach to a care circle-centric approach. And what I mean by that is that no man is an island, and we all understand that as we journey through our lives, that we have a support system that's critical to our success in terms of living a good quality of life and having a socially and emotionally satisfying life to achieve our goals. And so the thought is that we apply the social network paradigm to the creation of a personal care circle on the assumption that each individual has a social circle of other individuals with which they have a special relationship and who care about the patient or the individual, and that those people are willing to support the patient in terms of getting a quality of life and the necessary resources and services that they require. That if we empower and engage and activate that personal care circle, that the patients are more likely to, one, seek care, two, to cooperate with the treatment plan, and to engage the care team in that journey. And so the personal care circle is empowered and supported to help the patient receive the care and seek the care and maintain treatment compliance, essentially through education, information, and process transparency. And I'll share with you what that means from a solution and from a blockchain perspective. The intent being that if one can have a personally chosen social network around you that is focused on making sure that you meet the objective that your care team and you have negotiated with the patient, that you're more likely to be successful. And then the third paradigm shift that I want to discuss with you is the issue around trust. Trusting the patient to control the collection, storing, and sharing of their healthcare information with stakeholders within the health delivery system through a personal choice and taking active steps to do so. The current paradigm of information sharing across the health delivery system in many areas is a fragmented system where multiple stakeholders are collecting and gathering information about a patient, spending a large amount of resources and housing that information in their various electronic and other systems. And that's certainly been the case for hundreds of years, and has become more efficient at doing so. But it does not create a uniform insight into the patient that can drive the kind of improvement in clinical care and an improvement in the efficiency of resource utilization that we're all seeking. We have, as you are aware, significant interoperability issues in terms of sharing data and information across disparate technology systems all across the world, and the cost associated with maintaining and modifying those systems to give us a much better longitudinal information about an individual patient is becoming more and more complex. It's also resulting in significant emotional distress for both patients, families, and for providers when they desire a more complete record of the patient and have the incredible difficulty to getting that information. And so despite the federal government, for example, through the High-Tech Act, spending over $25 billion in the last decade on interoperability, we have not reached the place where we can say that interoperability and the sharing of electronic information across the ecosystem is meeting either the needs of the clinicians and or the patients as they try and provide the best care available to individual patients. So the thought behind this is, what if the patient, through a digital wallet, controls their healthcare information as is relevant to their needs, and have control and the ability to choose who to share that information with through a degree of sharing and transparency that improves interoperability across the ecosystem. And by placing the patient in the center with a supporting care circle of their choice, engaging with the traditional provider networks through our systems, we can essentially create a care network where for the right reasons and for targeted conditions, we can empower patients and the ecosystem so that some of the interoperability challenges are minimized and in some cases removed. So if we'll go to the next slide, please. Solve.Care, with that thought in mind, has looked at the various technologies that are available. And there is an opportunity with blockchain or distributed ledger technology to enable care administration networks or care networks, be they physical and or virtual, to share information and empower patients, the personal care circles, and the care networks by creating trust through auditable transparency in the best interest of the patient. And what does that mean? If we'll go to the next slide. I maintain that one of the reasons we have difficulty with interoperability and especially sharing meaningful clinical information at the time of service to meet the needs of the various stakeholders is less related, in my opinion, and it's my opinion only, to interoperability technical issues as opposed to trust and auditability of the information. And what I mean by that is we are all working very hard to make sure that the information we have on an individual patient is as accurate and as complete as necessary. And we are suspicious of any information that is not generated and curated by us, by our individual systems. And so the technical ability to share information through HLA7, through HIEs, through CDAs, and the various other technical methodologies that exist has existed for a long time. And part of that challenge is because of the distributed nature of the various technology legacy systems and the workload that's put upon healthcare service providers to meet information in a timely manner when there's very, very limited time to engage with the patient. And so Solve has developed a global ecosystem platform that uses blockchain technology essentially to place the responsibility and control of selected, impactful clinical and other information in a digital wallet in the hands of the patient, then allowing the patient to design or invite a care circle of interested individuals to help with engagement, motivation, and then share that information with digital wallets to the traditional healthcare system, be those physicians, practices, networks, care coordinators, health plans, and or any other stakeholder. And the unique part about blockchain is the ability to synchronize information, to track and audit the fact that an event occurred, and then distribute that across the entire distributed ledger system so that each person with the appropriate role and authorities will know that a specific event occurred, and thereby building trust. And trust with the patient in the center, with appropriate information, we believe will unlock possibilities to improve interoperability and improve clinical care. So essentially the global ecosystem consists of a care network, which is defined as a virtual or structural network enabled by blockchain technology that has a very specific purpose in terms of scope and outcomes that want to be achieved. These networks, because of the nature of the technology and the infrastructure, can be joined by various wallet holders to drive very specific objectives and outcomes depending on the design of that network. And then, of course, integration with third-party solutions. The Care Wallet is the electronic digital unit by which each role player can decide who to share information with under which conditions, and allows to the blockchain then to share those events across the ecosystem to drive very specific actions. And inherent in each care wallet are what are called care cards. Care cards essentially are secure distributed applications that are inside the wallet that interact in sync with other wallet depending on the permissions and role and intent of these various apps. And of course, this ecosystem is real time and can be configured to meet the needs of multiple care networks. The objective then is for the patient to have a digital care wallet that belongs to the patient, in which I am collecting my healthcare information in a secure manner, supported by my social network, then engaging with the traditional health delivery network of my choice, where I can access information and events and perform specific actions as designed by the system to allow for care coordination and synchronization across the network. And of course, the network can have as many role players as the network needs to drive the specific scope, outcomes, and objectives of the network. And so I want to share with you just a little bit of what this looks like and what is possible. And then Jami will explain to us how this was deployed across the Arizona Care Network. Next slide, please. Blockchain, an example of the use at the Arizona Care Network, is for the use of care coordination. So, for example, it is exceptionally difficult for patients in many areas in the world to get access to health delivery systems and physicians and providers and services, simply because of the difficulty technology in terms of getting access to the system, and or because of the demand for time and services across the ecosystem. And so patients spend a lot of time, and I can certainly speak to that personally as a diabetic, trying to coordinate care across the ecosystem, making phone calls, return calls, online portals, etc., etc. And that takes a lot of time and a lot of resources. And many patients are busy, have very active lives, and if they can't get the access that they need in a timely manner, will stop asking for access with its resultant consequences. So in a blockchain environment such as this, the patient will request an appointment. The appointment event, i.e. that the specific wallet has requested a specific service or appointment in this case, is broadcast across the distributed ledger. The wallets that are connected to the network, be they physician wallets, practice wallets, network wallets, whatever the service provider is, will be able to see the event request. Somebody within the network, based on their role, capability, and service delivery, will accept the request for services. That's then documented in the ledger, and the entire ledger is updated. So there's immediate synchronization. So it really allows you, based on the basic technology, to really manage demand across a broad ecosystem, and also to distribute that demand across the entire ecosystem. And we'll show you examples of that. The event is always documented in the ledger, but it's done so in a manner where somebody can see that the event occurred without the details of the event. And in healthcare, as we think about using personal health information and personally identified health information under HIPAA, for example, in the United States, we want to make sure that the information is as secure as possible, that there is control of the patient, and that the patient be allowed and enabled to share the information with stakeholders that can drive the objectives of the patient in terms of health and care coordination, and that we have a record of that to create trust. And so the next slide, please. The intent behind the use of blockchain for this specific purpose, i.e. care coordination across care networks, is really to allow the patient and their family the ability to be educated around their condition. So for example, in a patient with diabetes, by providing education and information to the patient that helps them understand their condition, the goals of their treatment, the various benchmarks in terms of what excellent care looks like and what the guidelines are, for example, through the use of the American Diabetes Association guidelines, and allowing the individual patient wallet to share that with their care circle. We're achieving the ability not only to educate the patient, but also their trusted advisors in terms of their social circle, on the assumption that if the patient knows what best clinical care looks like, if we've enabled that care, we share that with their loved ones and their care circle, that through the support and encouragement of their care circle, which is an educated support and an informed support, that they will help the patient find, seek, and access the care that they need. So the care circle with the care wallet enabling that really allows participants to be on the same page, not just on the social circle side of the care circle, but also on the healthcare provider side. So we're able to inject into the care circle and into the ecosystem and empower the stakeholders around guidelines that are personalized and relevant to the patient. Network access facilitation, in other words, it's not good enough to know that you need a physician's appointment every 6 months and that you need the following tests done and that these are the benchmarks and these are the goals you should achieve through based on these guidelines and your physician's personal choice. But we're also allowing them to make those appointments and get access. A critical component is the ability to report symptoms. In other words, patients experience generalized and specific symptoms, and the traditional way is to try and get hold of your doctor's office or their staff and share that information with them. Through blockchain, we'll able to enable that in real time and get a response from the care circle and from the care network. Patient and care circle education, I think, is a critical component that can be enabled by the solution. It is important for the patient to understand not only the gravity of their condition, but also what's possible in terms of best quality care, appropriate care, timely care, and also share that with their care circle. A personal care plan is the goal. In other words, as the care guidelines and the various benchmark are synced across the ecosystem under the control of the clinician or the care network, everybody knows what is trying to be achieved. And then a unique capability is around medication reconciliation. I know certainly from my experience that we have spent a lot of time trying to create an accurate medication list. Most of that work occurs during the episodic visits of a patient and when they access the health delivery system. It takes an incredible amount of resources because, of course, having a reconciled, accurate, current medication list is a critical component of making sure that the patient gets the best therapeutic results from the medications, but also to prevent a potential harm from interactions and various other things. And we've spent a lot of time distributing that task across the health delivery side with very little patient input. I think what is important now is that and Jami will talk about this and demonstrate to you, trusting the patient to create a medication list, sharing that list with the care circle to support them and make sure it's accurate is probably one of the best ways we can get a reconciled medication list, and then sharing that across the ecosystem certainly allows the opportunity for the formal health delivery system to detect very early, prior to the patient actually accessing the health delivery system, that they've either discontinued the medication, that they're not using something correctly, or that there's been an addition or a deletion from the medication list, either as a consequence of seeing a different provider and or unilateral patient decisions. And I think that information then being shared through the syncing capability in real-time update across the ecosystem allows the provider side to say, We've just got an alert, for example, that the patient has discontinued a statin in a patient with high risk for cardiovascular disease, and you'll see that there's an ability to ask the question, why did that happen? What were the circumstances? And to take action. So a very important feature of a care network. So the intent of a care network is to provide information that's relevant. It is not a complete medical record. It is not intended to be a comprehensive, detailed, deep data mart. It is intended that it provides information relative to the task at hand, and that it be under the control and oversight of formal care networks where there's an ability to set standards of care, benchmarks, and to respond to the patient's need for additional care, information, education, and services. Next slide, please.
Thank you, Dr. Hanekom. I just want to say to the audience watching and to the entire Solve.Care team, it has truly been an honor and a privilege to be a part of this journey. Arizona Care Network is a complex, accountable care organization. The complexities is on the screen. I'll talk a little bit about that. But when you think about how we can take the complexities of healthcare and how we can use technology to better that environment, not only for the provider, but for the patient, for those family members that are helping care for those patients, how can we be a part of that journey? How can we make a difference? And the partnership we have with Solve.Care has really allowed Arizona Care Network to leverage its experience, its expertise, as well as its network to impact the patients differently. Arizona Care Network is a physician-governed organization with over 5,800 providers in our network. The majority of those providers are independent businessmen and women that have infrastructures in place that do a great job managing their patients, but they don't necessarily communicate across the network seamlessly like most of healthcare. There are over 1,800 care locations within our network, which means accessing care and determining where points of care should happen is complex for patients. And where we can intervene and participate in that journey with a patient is important to us at Arizona Care Network. We have over 300,000 value-based lives, where 10% of that population are the diabetic patients. Earlier, Dr. Hanekom talked about the prevalence of diabetes across the country, and ACN and Arizona fall right within that 10% marker. We have 13 different value-based contracts, so we have patients that fall within the Medicare, Medicaid, commercial, as well as the Medicare Advantage populations, where those patients have a variety of comorbid complications, where diabetes is playing a very specific role in exacerbating as well as driving healthcare costs. ACN, through its efforts, have saved nearly $550 million in healthcare expenditures through its efforts, and we expect that our partnership and our work with the Care Wallet, especially with the Diabetes Care Administration Network, will continue that effort in helping improve quality and decrease costs. Next slide, please. So Dr. Hanekom talked a little bit about the backbone of blockchain and how it supports the Care Administration Network. I want to talk a little bit about specifically the Diabetes Care Network and how Arizona Care Network is leveraging that in order to combat diabetes as a whole, and empowering the patient to understand where they have opportunities and where they can make an impact. The Care Wallet for diabetes is specifically teaching and driving to those ADA guidelines, where a patient has an opportunity to understand, what are the evidence-based guidelines in a language that is meaningful for them, how it can impact their sight, how it can impact their mobility, how it can impact their overall health. The Care Wallet allows for patients to see not only those guidelines, but how they're tracking towards those guidelines. It gives patients recommendations on how to manage those symptoms better, how they can identify the potential risks as well as the outcomes. They can collaborate with their physician to understand what now, how do I manage my diabetes better, and what should drive my conversation with the physician. There's an awareness and ability to manage their medications better. Dr. Hanekom talked a little bit about the reconciliation component. So the patient has the ability to let us know what medications they're actually taking. It's not just what has a physician prescribed you, but what are you taking? What's in your medicine cabinet today? You know, are there over the counters? Did one specialist provide one medication while the primary care provider provided and prescribed something different? The patient is really the owner of their medication lists. They're the ones who know what they're actually taking. And the Care Wallet will help them document that and bring that with them to the various appointments, and specifically helping them understand with the ADA guidelines, are they taking what they should be taking for diabetes? Do they understand that there are medications that will specifically protect their heart? Do they understand the components that are important for the diabetes care? The Care Wallet also for Arizona Care Network connects those patients to a care coordination team. Dr. Hanekom talked about healthcare as being a team sport, and certainly at Arizona Care Network, we have a team approach to how we manage that patient. I will talk a little bit about that in a moment as well. But of course, at ACN, since we are a physician-managed, physician-run organization, we strongly believe and support that the patient belongs to the provider, and that we are not there to interrupt that relationship. Rather, we're here to support and augment that relationship and help the patient get the care that they need at the right time in the right place. We also recognize that it's not just the patient, it's not just the provider, it's not just the nurse or the social worker, it's the entire care circle. The care circle may be that patient's neighbor, it may be that patient's spouse, it may be someone from their church, anyone whom that patient wants to engage and collaborate their healthcare with. Oftentimes, it's the care circle that's really the one that's motivating that patient to get the care that they need. You know, if my child were in my care circle and they said, Mom, you know, we really want you to go have your blood sugar checked, we're worried about you, I'm more likely to do that than if simply someone, you know I need to do it, but if my child tells me to, I'm going to be more inclined to listen. So it's about making sure that people that are important to this decision making of the patient are involved and are aware as the patient allows and directs for this to happen. Next slide. So at Arizona Care Network, as we've had the DCAN, we are very proud of the team model that we take to managing that patient. We have concierge and transition navigators that will help the patient with the referral management as well as preventive services. Through the Care Wallet, they can understand that they need an annual eye exam. They might not know where to get that eye exam, but they can communicate directly with our care navigators to understand, I need a retinal eye exam. Where is a retinal eye exam close to my home, maybe close to my work, within my network? How do I get that care and facilitation of those appointments and those needs? We have registered nurses and social workers that help manage those more complex patients that maybe have a complex medication regimen and they need a nurse to help them understand the side effects and how to better manage that. They may have housing needs. They may have difficulty with getting to their appointments or getting their prescriptions filled. Our social workers can step in and help them understand that. Oftentimes, a non-compliant patient isn't non-compliant because they want to go blind or because they want to lose their leg. There's often a social determinant that is the reason for their non-compliance. And really, the social workers are there to help the patient understand that. And the Care Wallet allows them to have that conversation at their time when they're ready to have that conversation. We also have complex care clinics where we actually will specifically enroll patients at these clinics where there's additional resources, health coaches, navigators, nurses, social workers on site that can manage those super complex patients to help get their diabetes and their other comorbid conditions under control. I talked a lot in the beginning about the physician and the role that they have in managing the patient. We do have clinical performance representatives that help educate the patients on what programs we have and really more information around their patient population that they may not be privy to. Physicians do a phenomenal job taking care of patients at the point of care, but when the patient goes outside of their office and receives care, they're often blind to what's happening. And our clinical performance representatives bring that information back to them. The Care Wallet supports that by having additional metrics and different additional activities available to the Care Wallet that can be shared directly with the physician. Arizona Care Network, as we've rolled out the DCAN, we're very cognizant of that physician relationship, and we know that when we communicate to the patient that the DCAN exists and that the Care Wallet is there to help them, that they're going to ask their physician, what is this Care Wallet? What is this DCAN thing you're talking about? So we've been very specific as we've rolled out the DCAN to talk to the physician in their practices first, to make sure that they know what's coming and what we're communicating with their patients, so that they're ready for the patient to come with their phone and say, you know, here's my medication list. Here are my current lab tests that I had done. Oh, by the way, across the street. We've really empowered the providers to understand what's coming out. We've then subsequently reached out to the patients to let them know that this is available to them, how they can communicate with their providers, how they can communicate with our entire care team in order to better manage their diabetes. We've been collaborating with the local market, different associations to understand and support the program. As more information comes out in the media around what we're doing here at ACN and how we're supporting diabetes, we want to make sure that those key stakeholders are well informed, so they can be a part of the journey and they can continue to promote the various programs within their populations and within their stakeholders. We're excited to be looking at phase 2 of rollout with our program, where we can look at additional diabetic populations and understand how education and information around the guidelines and empowering the patient will make a difference in not only their access to care, but their adherence to guidelines, their access to services that are meaningful and manageable for their own care. I would love to take a moment to show you a video about how the actual Care Wallet works and how the various team members engage with each other through the Care Wallet. Self-Care team, if you could please load up the video and play it for our audience.
Wonderful, thank you very much. As you can see, as we partner and collaborate with health delivery systems and individual practices and patients and their families globally, whether they have a cell phone or whether they have a very rich, complex technology environment, the principle being that we want to drive better care and drive increased satisfaction to providers and patients and lower medical costs and create value for the ecosystem remains at our forefront. It's always about the best interest of the patient. We have been privileged as we engaged healthcare providers and patients and communities across the world that there is significant interest in what we're doing. An informed and an empowered patient who is supported by loved ones and friends who, within the context of a close physician relationship and the support of care teams across an ecosystem, will likely drive the best results. And so I am very pleased with the results that we are achieving with the Arizona Care Network, and I specifically want to thank Jami and the rest of the team and their thousands of providers that have co-developed and co-designed this with us, that we'll continue down this journey. I would like to call to action to anybody. If you're passionate about the quadruple aim, and if you're looking for an enabler, please reach out to us, whether it's the final last mile to the patient physician care coordinator, or whether it's the only um, technology enabler solution that you can afford because of a lack of the deep infrastructure that exists in other countries. It's likely that we are able to help you through that journey. Empowering patients and making sure that they can live the best life possible within the constraints of their environment, their financial, political, and other social circle needs to be our goal. And so I want to end once again with Dr. William Mayo's admonition that we need to cooperate, we need to collaborate, we need to make things simpler but more effective, but always in the best interest of the patient. Thank you very much for joining us. I hope to hear from you. And if you have any recommendations for us to improve and accelerate what we're doing, please feel free to reach out to myself, Jami, or the Solve.Care community. Thank you very much and appreciate your joining us.